COVID-19 has reached almost all parts of the world. Just when we thought we are getting away from COVID-19, Omicron emerged. Since it has emerged in mid-November, Omicron has raced across the globe like wildfire. Though it has milder symptoms, almost the same as seasonal flu, the World Health Organization has warned that Omicron cannot be dismissed as a common cold or a mild disease, and there are reasons to worry about it. People with diabetes and heart disease can face severe complications. Due to the previous lockdown and work-from-home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. So if you have any questions you would like to ask them, please send them to us via WhatsApp to the following number. The number is +91 91 67 666 941. That is the number to send us your questions for our experts. Please also send us your name and your location. Today joining us are Dr. Lakshmi Hemanth, MBBS, MRCP, PG DIP, Diab, Consultant Physician and Diabetologist, Lakshmi Diabetic Center, Shivamoga, Karnataka, Dr. Jagdish Mulchandani, MD, DNB Consultant, Endocrinologist, Diabetes, Thyroid and Hormones Clinic, New Delhi, and Dr. Shalini Garg, MD, DM Cardiology, Senior Consultant, Cardiology, Director and Head Cardiology, Jindal Hospital, Bharatpur. Thank you all so much, doctors, for joining us on this very special show. I would like to start with you first, Dr. Hemanth. Tell us, what are some of the symptoms of the Omicron variant of COVID-19? Are the symptoms the same for people with diabetes as well?
Hi, good evening, everybody. As we all know, we are facing this pandemic from last 2 years, and this Delta variant is newly emerged. As you said earlier, we noticed this in first time in South Africa. Compared to the Delta variant, which showed mainly loss of taste, smell, and shortness of breath, and acute respiratory distress syndrome, which is acute shortness of breath. Those are the symptoms of Delta variant of COVID, but this Omicron variant is mainly showing headache, sore throat, dry cough. Those are the salient symptoms, but we do have fever, loose stools, backache, and myalgia as some of the other symptoms of this Omicron variant of COVID-19. It's spreading really widely and very quicker compared to the Delta variant. Pertaining to diabetes, the symptoms are nothing different to common people, but it all depends on how well controlled your blood sugar is, and your HbA1c levels. But the complications once you get this Omicron variant would be higher if your blood sugar is not very well controlled. And these symptoms could be a normal flu also, so it's better you always go and get it checked with your doctor. But be safer and don't neglect it.
I think what you pointed out, that people with diabetes need to be extra careful. I mean, even if they get Omicron, the complications could arise. So that's an important point. So thank you for explaining that, Doctor. Dr. Mulchandani, we have a WhatsApp question from our viewer. Amrita Gupta from Kolkata is asking, my husband is a type 2 diabetic. Post-COVID, his fasting glucose reading is fluctuating hugely from 76 to 201. What could be the reasons?
This question is very common, it's happening all over. Most of my patients are having these problems. Post-COVID, there are situations, when, first of all, when the steroids were given to somebody during COVID, the sugars must have gone up. Sometimes you need insulin also during COVID, But after stopping steroids, the sugars may suddenly come down. So you have to be careful that the same dosages of medicines cannot be continued which were given during the COVID. Other things, that sometimes we have seen that COVID can also cause damage to the pancreas. So some people who had already had diabetes and some who did not have diabetes, they have been precipitated into a new diabetic case because the pancreas got damaged by some COVID pathology, which is not very common, but which is has been reported now. So if such is the case, then the dosages of medicine will go up, and some people will also need insulin. Other common mistakes are that people are missing their meals and their doses sometimes at night they tend to miss their dose, then the sugar will be high. And if you take a dose which is inappropriate, then when the morning at about 6 o'clock, the sugar will go very low, which is called hypoglycemia. So you
Okay.
have to follow up with your endocrinologist or with your diabetologist, and
Okay.
also make sure that the diet has been, at night you don't miss any meal. So don't miss a meal or don't miss any doses for that. And I think best is to do a monitoring of your blood sugar, 3 or 4 values per day, and also get a HbA1c done and get back to your doctor.
Okay, so monitoring blood sugar levels always, and of course not missing a meal or the dose, and of course visiting your physician as and when required. Dr. Garg, what will be the risk of a heart attack post-COVID-19 in people with diabetes as compared to a person without diabetes? This question is a WhatsApp question from one of our viewers. Jayashri Guge from Beed, Maharashtra is asking this question.
Okay, risk of heart attack increases 3 to 8 times 1 week after COVID infection and decreases steadily in 1 to 2 months thereafter. And the cause behind it is the COVID infection triggers an exaggerated inflammatory response that makes blood clots more likely, leading to heart attack, both during acute infection as well as during recovery. So per se, diabetes mellitus is a leading risk factor for heart disease, and individuals with diabetes mellitus with uncontrolled blood sugars have an increased risk of more pronounced inflammatory response. So they are at greater risk of heart attack as compared to non-diabetic patients.
Okay.
So blood thinners are prescribed by doctors to prevent this complication.
Okay.
Post-COVID recovery, the patient should regularly monitor their blood sugar levels along with follow-up with the doctor.
Okay, so I think the same regular monitoring, and post-COVID one needs to be extra cautious, and like you said, doctor, I think the first 1 to 2 months are very crucial, so I think regular monitoring is key. Sure. Dr. Hemanth, how do other factors such as high cholesterol and high blood pressure affect one in case of diabetes? This is also a WhatsApp question from our viewer, Harsh from Pune.
Hi, thank you. Certainly, we all know this high cholesterol and high blood pressure and the diabetes, these three conditions go hand in hand. And these high blood pressure and high cholesterol do affect the care of diabetes. Just to brush up the knowledge for the viewers, the cholesterol, which is nothing but a fat, we get the cholesterol by eating the animal food, or our body itself can synthesize this cholesterol. And we have types of cholesterols, bad cholesterol and good cholesterol. Once we have high level of bad cholesterol that affects our blood vessels largely, it will go and deposit in our blood vessels and like a wax and obstruct the circulation of the blood to vital organs like brain, eyes, heart or kidneys. That's where we end up having a heart attack or a stroke, and we lose our vision suddenly.
Sure.
So the diabetes is mainly associated with dyslipidemia. In diabetic patients, we get low HDL cholesterol, which is a good cholesterol, and high LDL cholesterol and triglycerides. Those are the bad cholesterols. So most of the diabetics do have high cholesterol. And also this dyslipidemia is a precursor for type 2 diabetes. They go hand in hand.
Okay.
So high cholesterol is bad for diabetic patients. Coming to the blood pressure also, the high blood pressure do causes diabetes. It's a controversial issue, but we have a theoretical explanation that some of the hormones like aldosterone or cortisol does make you prone for diabetes once you have high blood pressure. And most of the diabetics, because of high blood glucose circulation in their blood, are prone to have high blood pressures. So what I would say is, of course, diabetes, high blood pressure and high cholesterol levels are dangerous to health. Please get your cholesterol level and blood pressure checked regularly and keep it under control.
Absolutely, I think that is key, since all of them are connected like you've just explained it, doctor. It's key to keep check on your high blood pressure, blood pressure as well, along with of course cholesterol. Dr. Mulchandani, the key to manage diabetes is of course to keep a check on blood sugar and keep control of it. What is an extension version of the ABCs of diabetes? Can you tell us that?
I think there's a very simplified version of what you've asked,
Okay.
ABC of diabetes. A stands for A1C, as doctor has already said, which is HbA1c or glycosylated hemoglobin, which is an average of last 3 months of sugar. And this parameter should always remain below 6.5. And elderly patients below 7. This is very essential because this will indicate a good control of diabetes. So A stands for A1C, B is for blood pressure, as doctor has already mentioned that it is very critical to control the blood pressure, because blood pressure is one of the causes of getting, not only heart problems but also kidney damage and even strokes. which is also again very common in diabetic patients. And third is cholesterol, as doctor has already mentioned. C is
Yes.
for cholesterol, and I will actually go on to add D and E also, because D will be for diet, which is an essential part of management of diabetes. So a good dietitian will always help you to control your eating habits and your diet, and what to eat and what not to eat. And D also stands for drugs, which should be given by a specialist and a very controlled manner. And you know, there are a lot of drugs, including insulin, which can be given to control diabetes. And finally, E, which actually should have come in the top of the list, you know, because this is A, B, C, D, and E. E is for exercise. Exercise is, you know, the most important part of lifestyle management, which should be tried in every patient even before starting any drugs. So this makes A, B, C, D, and E very simple, you know, for the viewers to understand.
Very simple and very well explained, and of course need of the hour. So I mean, ABC, I think all the diabetic patients know, but D and E, of course, diet, drug and exercise, very well explained, Dr. Mulchandani. Dr. Garg, one of the most frightening myths about heart attacks is that they will kill you. What are the chances of survival after a heart attack?
Acute myocardial infarction, also known as heart attack, is associated with approximately 30% mortality rate, and approximately 50% of these deaths occur prior to arrival at hospital. So getting rapid medical attention is absolutely critical. There is a dictum in medicine that time is myocardium, and myocardium is heart muscle. So in a type of myocardial infarction, also known as STEMI, there is 100% occlusion of blood vessels supplying the heart muscle. Early opening of these vessels is necessary with the window period ranging from 30 to 90 minutes, depending on the procedure. Prognosis is highly variable depending on extent of infarction, residual LV function, and whether the patient underwent early revascularization or not. So early perfusion is STEMI is very necessary, along with preserved LV function and disease modifying drugs which are prescribed to the patient later on, which is associated with improved survival.
Okay, now thank you for explaining that. So on that note, we're going to be taking a very short break, but if you have any questions which you would like to ask our experts here today, send them to us via WhatsApp. The number is +91 9167 666 941. Yes, that's the number to send us your questions for our experts. Please do also send in your name and your location. We'll be right back after this short break. Welcome back. You're watching Beat Diabetes Myths and Facts. Dr. Hemanth, it's a common myth that only overweight individuals will develop diabetes. Are skinny people immune to type 2 diabetes?
Thank you. Diabetes is certainly associated with overweight individuals, especially if they have a BMI, the body mass index, or the weight according to their height is above 25. It is not, having said this, it is not like thin people are excused from having type 2 diabetes. We are seeing type 2 diabetes in skinny people as well.
Okay.
We have types of diabetes, type 1, type 2, gestational diabetes, and drug inducers, so many other different types of diabetes. Type 1 diabetes is mainly seen in thin individuals, but nowadays type 2 is seen in thin individuals as well. The factors might be the genetic factors or the family history. If we have a both parent having diabetes, the risk of the kid having the diabetes will be higher,
Okay.
Compared to without any family history.
Okay.
So I do agree that this is certainly a myth to say thin people are immune to diabetes.
Okay, thank you for clarifying that. Dr. Mulchandani, many symptoms of diabetes go unnoticed because we are not really aware of it. Can darker skin on the neck be this? Can that be one symptom of diabetes?
First, let me clarify that diabetes is quite a silent disease. Most of the times you will not have any symptoms.
Yes.
So a checkup after a certain age, after say 25, with a family history, is very essential that you keep check on your sugars.
Okay.
Now you're talking about pigmentation, which is darkening of the skin on the back of the neck, sometimes in the armpits and the groins also. And usually it happens in younger children who are overweight and they are brought to us by their parents, or young adults, you know, they come with some pigmentation on the back of their neck and in their axilla. So what is this pigmentation? Is like a velvety carpet, you know, and it is called acanthosis nigricans in our language. So this indicates of a lot of insulin in the body, high level of insulin. Why high level of insulin? I'll explain to you. When you eat food or carbohydrates, your body produces insulin, But if the insulin is not effective, then the body tries to produce more insulin. And this high level of insulin is a pre-diabetic condition. So these children or young adults who are having pigmentation, they are having acanthosis nigricans, which is the pigmentation, which is also indicated that their insulin levels will be high. So insulin levels should be tested in these people. And these are highly prone to diabetes in the later life.
Okay.
And in fact, as doctor said, we have young people coming to us with diabetes. They have these pigmentation in the back of the neck, on their groins, and their blood sugars are found to be very high suddenly. And it is happening in the school children. So it's a very alarming situation that we are getting diabetes in very young adults. Even at the age of 20, children are being brought to us, and I think this is another epidemic which we are facing. So overweight or being obese is probably the underlying pathology.
Yes.
It is also associated with the family history of diabetes, and it has also been associated with certain other things like insulin resistance.
Sure. And like you rightly said, I mean, right time to go to a doctor, getting yourselves checked, and awareness on this, like you said, the numbers are really going up at alarming, the numbers are really alarming. Dr. Garg, what is obstructive sleep apnea, what they say, OSA? And is it a risk factor for heart disease? And how does one, really manage this risk factor?
Okay. Obstructive sleep apnea is the most common type of sleep disorder that involves cessation or significant decrease in airflow in the presence of continuous breathing efforts. So there are recurrent episodes of upper airway collapse during sleep, leading to blood desaturation and leading to arousal from sleep. It is associated with excessive daytime sleepiness also, and increased cardiovascular morbidity as well as mortality in the form of drug-resistant hypertension, ischemic heart disease, cardiac arrhythmias, and heart failure. Along with genetic predisposition, obesity, large neck circumference, and large tonsils or adenoids, macroglossia, and low-lying soft palate are some of the predisposing factors to it. The treatment is continuous positive airway pressure, also known as CPAP.
Okay.
It is the gold standard treatment for obstructive sleep apnea. It functions to provide continuous positive airway pressure to keep open the airways in cases of collapse.
Okay.
In cases when CPAP fails, then uvulopalatopharyngoplasty or other maxillomandibular surgeries may be considered.
Okay. So CPAP is a way, and this is something which needs to be taken care of, right? So that one avoids a heart attack. Okay. So Dr. Hemanth, tell us, what are the advantages of HbA1c testing over glucose measurement for the diagnosis of diabetes mellitus?
Glycosylated hemoglobin, HbA1c, this is a test nowadays widely done in most of the diabetic clinic. This is a very good indicator of how well controlled the blood sugar is from over a period of last 3 months. This is normally once we have high blood sugar in our blood vessels, it will go and get deposited on the red blood cells.
Okay.
We take these cells and measure the amount of the glycation on these RBCs and give an average reading of blood sugar control over a period of last 3 months.
Okay.
The glycation is directly proportional to the amount of blood sugar in the blood vessels. The main advantage of this test is it can be obtained at any time. There is no need for fasting, and it will give, as I said earlier, the average of average blood sugar control over a period of last 3 months.
Okay.
So the ADA, American Diabetes Association, and European Association for Study of Diabetes, and International Diabetes Federation, all these associations joined together and accepted HbA1c as a gold standard test to assess the severity of the diabetes and how well controlled it is over a period of last 3 months.
Sure. Okay. So it gives you the
disadvantage. Sorry.
Yeah, it's an advantage because you know of the 3 months, and it's not at what you've eaten just at that point. So definitely it's more clear on what your levels are. Dr. Mulchandani, diabetes can lead to complications in other areas of your body. Which interventions may help prevent or limit the complications of diabetes mellitus?
I think the first thing to understand is that diabetes is a disease which can be fought very easily, if you are careful. So there's nothing to panic, You have to follow the ABCD, as I said. If you are getting your HbA1c done every 3 months and your blood sugars profile at home, which are very non-invasive and very simple technology is used, where you use a glucometer. You keep your sugars below 150 after every meal, and you keep your HbA1c below 6.5.
Okay.
Now the other intervention is also non-invasive. For people who are having diabetes for a long time, they should check their urine for albumin. So they start excreting albumin in their urine, which sometimes can be tested only in the lab. Some people come and tell me that they are getting some frothy urine, which is absolutely incorrect. You have to go to the lab and get a urinary albumin checked in the. If the albumin is high in your urine, your kidney may be getting affected, but that can also be checked with medicines.
Okay.
Other thing, as Dr. Hema has said, that cholesterol, sugar levels have to be very, very appropriate.
Sure.
So you should get your lipid profile every month.
Okay.
And in the end, I will say retina. The retina has to be examined by an ophthalmologist every year. So you can prevent blindness, which is a major cause of blindness. Diabetes is a major cause of blindness even in the Western world and also in India. And for cardiac, I think Dr. Garg will vouch that doing a periodic checkup like a treadmill test or echo, after a certain age, say after the age of 50.
Yeah. So actually, rightly, like you're saying that, once you know what is affecting you, you can really deal with it well. And like you all have all, in fact, thank you so much, doctors, for explaining us, everything about diabetes, how one can deal with it. And especially, like you said, A, B, C, D, E. I think it's about managing the disease really well. So if you all have any questions you would like to ask our experts, please send them to us via WhatsApp to the number +91 9167 666 941. Also, do not forget to send your name and your location. News will continue on the other side. Thanks so much for watching.